Hi guys, welcome to my first vlog ever! First. So now that I've made it this far, which is already coming to the last week of my obstetrics part. So in this OB-GYN department, we have a total of 6 weeks. So 3 weeks for OB and 3 weeks for gynecology. So there we go. I'm almost done with my first part of it. So in the obstetrics department, it's a very early department because our rounds would start at 8 a.m. And of course, as an intern, you are expected to be there earlier because you're gonna have this little tiny box that you're gonna have to prepare. And within that tiny box are like equipments that the professor would use just in case they want to check up on their patients one more time before the surgery or check on wounds again at post-op. So yeah, number one main task as an intern is to make the professor's life honk. So there's a lot of honking action going on there. Okay, back to what I was trying to say. So our first main task as an intern, hands down, is to make the professor's life as easy as it could be. So our second main task is wound dressing. And as I have mentioned, usually obstetrics patients are patients post-op from their cesarean section. So wound dressing comes in play very frequently, like every day. You're gonna at least have at least 3, 5, depending on how many patients that your groups had intake. Am I saying the right word? I think I am. So yeah, wound dressing is really crucial in this department. And of course, you're gonna have to do it according to protocols and make sure it's aseptic, blah, 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 blah. So yes, that is our second task. So our third task, I think comes along perfectly well with the second task, which is removing sutures. Yay! Because removing sutures means that most patients could leave the hospital and go back home and resume on with their lives. And of course, bring a baby home. So yeah, removing sutures is like our third most important job as an intern. And there comes our last job as an intern, is our fourth task. This fourth task takes place in the OR, the operation room. And our main job, forever job as an intern, is to be clamping umbilical cords of the babies. And which I find this job quite satisfying actually, because I get to touch the baby. Well, not the first one to touch the baby, but I get to touch the baby's cord first. So something satisfying around that area, you know, it gives me the satisfaction. And of course, the babies, they're just adorable. And yeah, that concludes my 4 main tasks as an intern doctor here. So pretty much hands-on stuff, and you would be doing it over and over and over again until you'll just get sick of it, sort of. Well, I know it's good for you because you'll practice until like you know it. I don't know what I'm doing. So aside from all the fun stuff and of course lecture classes, we also have something called, well, I wouldn't really call it a shelf exam, but it's something similar to a shelf exam, because by the end of each department, we're gonna have this exam where we're supposed to pass to proceed on to our next department, so that they would know that we have learned something from their department. So now that I have already experienced the obstetrics part of the OB-GYN department, I have to say that obstetrics is like a mixture of surgical and internal medicine, because you know you're gonna have to be taking care of mommy and baby before operation. Then the surgical portion comes in where you have to do a C-section on them. But then of course some would prefer to do a natural birth, so I wouldn't count that as surgery. So yeah, I find that this department is for people who are not fully into surgery and not fully into internal medicine, so it's like a mashup of everything. And in this department, it's not always about babies and mommies. Like, there are other cases too in here, like take tumors, for example. There's going to be tumors in a uterus. There's going to be abortion cases. So yeah, there are many sides to obstetrics than what people assume it to be. So I was quite happy that I get to explore different aspects of this department. Another thing I want to touch up on is study materials for my steps. So just a reminder, I have not taken my steps yet, but so far this method has been working really well for me. So for those of you who ask me on Instagram, like what equipment, I keep saying equipment, what materials do I use, I'll be answering your questions here. So let's go. So the first two books that I would highly recommend is like the Bible of USMLE Step 1. So on this right side of mine, you have the First Aid USMLE Step 1, which comes out yearly, like every December. I know like right now the current version is 2017, but I have been using this 2016 books and I have annotated a lot of stuff inside. So I do not want to change anything for that. So yeah. And on this left side is the first aid question and answer. So this book goes like questions system wise. So if you're like confident in each system, then you could like go answer questions on this book, and it correlates well with each other. So I highly recommend these two books to start off. So the next family of books that I am going to recommend to you guys is the Kaplan series, and the subjects that I take on this Kaplan series are the biochemistry, anatomy, pharmacology, and Q book. This one is similar to the USMLE First Aid Q&A book that I just recently showed you, and Kaplan books are great for these subjects, and I highly recommend it because it's so clear, it's precise, it's to the point, and basically you would, after reading it, you're able to answer questions out of it. So yeah, that is my Kaplan family. So this one's a bit of a mix-up of everything, and starting from my left, it's the Clinical Microbiology Made Ridiculously Simple, and I find this book very, very helpful in trying to study microbes and stuff because it's just comical, it's funny, and I could recall it through stories that they have, you know, because it's written out in a story form, so it's easier to recall for me that way. And the second one here is the Neuroanatomy Book, which is high yield Neuroanatomy Book, and this book is really good in the aspect that they correlate pictures to what they're trying to describe. So yeah, this is the book I would recommend for neuroanatomy. And BRS physiology is like the queen of physiology, the king. Well, I said queen because Linda is a girl. But anyways, this book I would highly recommend for physiology because it is explained in a manner that they assume you are not so sure about your basics, and at the same time it's all high yield stuff. So yeah, physiology, BRS, that's what I've been using. Hi guys, welcome back to my face again. So first of all, I am terribly sorry for the fact that I could not find my pathology book. But But anyways, I am going to show you a picture here so you guys know how the cover looks like. And the book that I'm currently using is the Rapid Review by OB-GYN, and this book does a perfect job at explaining pathological processes. But what I like the most about this book is that they have this little tiny summaries on the side, which is like small fonts in blue color. So when you guys go through the So when you guys go through the chapter once and you guys just want to recall information for memorizing purposes, you could just like look at the summary there, and that saves a lot of time for me. So yeah, that is like my highly requested book for pathology. So I'm gonna bring this vlog to an end and, you know, conclude or wrap up this vlog. So I hope you guys enjoyed this vlog and my study materials, and if you find it useful, fun, educational, please click the like button, subscribe to my channel, and leave a comment down below so I know that what I'm doing is to your liking. All right, study hard guys and stay motivated. Bye.